Do you know what flavor of Gatorade dogs like best? Today we'll answer that question and so many more about keeping our active dogs healthy. Welcome to the Real Alaskan Malamute podcast, a podcast for Malamutes by Malamutes, talking about all things Malamute. I'm Lynn, your host, and I'm excited to introduce today's guest. Today we're talking with Dr. Kim Henneman. Dr. Kim has a slew of well-earned titles behind her name. She's a doctor of veterinary medicine. She's in sports medicine and integrative medicine. That includes Chinese medicine and chiropractic care. Her clients are equine, feline, and canine, the latter of which include search and rescue dogs, top agility dogs, avalanche dogs, and of course, sled dogs. She served as a veterinarian for several dog sled races, including the Iditarod Trail Sled Dog Race and the Finnmarksloppet Dog Sled Race in Sweden. Dr. Kim!
Hey,
I'm so excited!
Good morning. Hello.
I am very excited to have you here because you are our first guest of the Real Alaskan Malamute podcast and the Red Lantern podcast. So we're going to do a duel for both. So today we're going to talk about sports medicine injuries in the active dog. The Malamute community, I asked them on our TRAM Facebook page what they're doing. Everyone is doing a lot of things. Fast cat, agility, obedience, rally, backpacking, sledding, dry land, barn hunt, scent work, tracking, anything a Malamute can do, I think people are doing with their dogs. So
Barn hunt, huh? That's interesting.
Yeah.
Okay.
So I would imagine that in all of that, like every activity has its own most likely injury.
To a point. Because
Okay.
there's only so much that can be injured because of anatomy and biomechanics. You'll tend to have certain groupings of either the front end of the body or the rear end of the body or the back, depending on what they're doing. Say, for example, like obedience dogs, because they're always looking up and to the right at their person as they're working off of their left leg, they will tend to get a lot of issues in the lower neck and in the right front shoulder. It'll look like a shoulder problem, but it's not. It's oftentimes it's a neck. The neck has gotten compressed and they're kind of, sort of sitting like this a little bit. And so you'll see problems like with the obedience dogs with that. And then it gets compounded if they're jumping with the dumbbell and the retrieve, so they end up kind of like this all the time with something in their mouth, and that can get worse. They're always bent to the right, so to speak. Dogs like doing agility, you get all the normal agility injuries that a border collie will get, maybe compounded with a dog that's a little heavier, maybe a little more upright in the front end. You're going to have problems with that, but they can fall off the dog walk, fall off of the A-frame. They can do all kinds of various different things that twisting and running around and twisting a wrist. Barn hunt, they can pull an iliopsoas by jumping from when they're in the more advanced levels and they're jumping up onto a bale of straw. They can slip off of the straw, get an iliopsoas, pull a groin muscle, pull a hamstring. So for the most part, there are certain groupings of injuries that you may tend to see, but any dog can injure anything, anywhere, anytime.
Let's talk about the obedience. You talked about like they can get compression here. Is that a muscle thing? Is that a chiropractic thing?
Well, let me clarify. So it can be a muscle or a spinal fixation, and that's what chiropractic and osteopathy will adjust. So if you get enough tight muscles and you have maybe a strain or an injury to ligaments, they'll tighten and shorten, and then that'll pull the vertebra so the joint doesn't open as much on one side than the other. And in chiropractic, we call that a fixation. The osteopaths can call it a fixation or a lack of motion as well. And so that can become the fix can become a chiropractic issue. But if we look at just the injury alone, then I hear dog panting. If we just look at the injury alone, we're going to be actually looking at can be soft tissue as well as bony, and in the neck you have to include the disc, the intervertebral disc, because it can get compressed on one side, and so it can put pressure on the nerve, and then it can turn into a nerve injury. So that's how things can cascade and progress.
How would someone know that they're starting to have trouble? Like what would they see in their dog?
Well, it depends on their dog, and it depends on how good their powers of observation are. as you know, the Asian breeds, the ancient Asian breeds, the northern breeds are pretty tough. We kind of have a joke at Iditarod that a sled dog says, "Huh, my leg fell off. Well, I'll just pick it up on the way back," right? So you can't use pain as a metric with those dogs to tell whether or not they've injured something. So you have to look at, do they stand kind of bent? You know, are they arched a little bit the way that they bend? Do they hold their head a little to one side when they lay down? Do they flop over to a hip rather than laying down perfectly like a sphinx? When they lay down, do they draw one leg? Do they draw one leg back more than the other when they lay down? When they're gating, do they gait funny? Are they a little bit short on one leg? And is it worse on grass or a soft terrain versus hard or a sidewalk? So you just have to know your dog, know what's normal in your dog, especially if an owner gets chiropractic or osteopathy on a regular, or some kind of body work done on a regular basis. You know how your dog looks when it's feeling well, and then you'll know how your dog will compensate when it's ever so slightly off or has tweaked something, muscle spasm, pinched a nerve, strained a ligament to a joint. They won't stop. That's the problem. They won't stop. They'll just keep going, but they'll do it differently to compensate. And then it's the compensation that can get them into trouble.
Right. So that's interesting that you say you just have to know your dog and observe. I think I know my dogs really well, but as you know, Abby, when she tore that muscle in her pastern last year, what I didn't notice was that when she was eating, she didn't have all the weight over her right foot. She looked like she did, but I missed that foot turned out to the side just ever so slightly because she wasn't weight bearing, like fully weight bearing. So I think there's a lot of things we can learn as owners that maybe we don't see as easily. I learned a lot from that.
It's just a matter of, well, a lot of veterinarians don't see it either, because it's a matter of sensitizing your powers of observation to know what is normal and what is not normal, and understanding that compensation isn't abnormal at the time, but it soon can be, and just seeing that it's a warning sign that the dog is compensating for something else. I bet you won't miss that again, will you?
I won't.
No, you won't.
No. Nope.
But that's important because you learned from the situation, you learned from the experience, and now you're looking at your dogs with a softer, more intent, more detailed eye than you had before, and that's just experience and learning, right? Just like with veterinarians, you just learn how to do it.
Yeah. I mean, who would have thought that just that slight, I mean, it was just very little, but once I saw it, I couldn't unsee it.
Correct. And when I first graduated from school, when I was trying to see a lame horse, that sucker probably had to be non-weight bearing, or I wouldn't have noticed it, because I didn't have the experience of looking at a lot of different animals to be able to say, that's not a normal gait. So it's just experience, and people shouldn't beat themselves up for it as long as they learn and as long as they become better at handling and managing their dogs afterwards. That means, though, that it may be that they notice something that their veterinarian can't see. And they should be really strong advocates for their animal and not back down, and be sure and confident that they go, no, there's something wrong here. I know there's something not right with my dog. And if their veterinarian can't see it, try to work with the veterinarian to point out, here's what I see. And if they can't get their veterinarian to take them seriously, they need to maybe find another veterinarian, find someone who will listen to them.
So that is kind of a segue into something we talked about before the episode. How can owners advocate? I mean, general practitioner vets, they can't know everything. No vet can know everything. But as an advocate for our dogs, at some point, how can we say to our vets, could you consult? Let's use you. Could you call Dr. Kim or email Dr. Kim and just ask about this, or someone who might know a little bit more, maybe do a little research? Like, how could people approach without ruffling feathers?
Sure. Well, that can be hard. You need to know your veterinarian. You need to know what kind of relationship you have with them. The first thing to do is give your veterinarian the benefit of the doubt. Especially general practitioners do know more than you think. Sometimes the problem is time, not knowledge. They just don't have the time to look versus having the knowledge to look. when my interns roll through their rotations with me, the one thing I pound into them that got pounded into me at Purdue my first freshman year is for every one thing you miss because you don't know, you miss 10 because you don't look. And that's the problem sometimes as practitioners with today's, especially in a corporate practice, they sometimes just don't, they're not given the time to be able to really examine something the way they should. So what a dog owner could do if, the veterinarian goes, oh, it's a soft tissue injury, here's some medication, just say, but this dog owners can say, well, which soft tissue is it? Is this a muscle? Is it a ligament? Do I have to worry about this? Where can this possibly go? And then ask them to try to give you a more detailed answer. If they can't, then it's a good idea for a dog owner to maybe find someone who does rehab or PT. We can't officially say PT unless we've been trained in a human physical therapy program, so we use rehabilitation instead. But you say, okay, so can you give me a referral to someone who does PT? And hopefully if you have a good PT person, they can isolate out what kind of injury it is. You can go to a boarded sports medicine person. There aren't a lot of us around, but there are more and more, and they should be able to maybe do a better job of a physical exam to try to isolate what the tissue is. You could also say, hey, could you just go ahead and do an x-ray? So let's just make sure there's nothing going on with a bone or a joint. And if that's clear, you say, well, then what soft tissue do you think it is? It can be tricky, you have to do it in a way that won't ruffle feathers, but more and more, I do believe dog owners need to become their own advocates for their dogs and stay steady and strong if they really believe something very clearly with their own dog. And try to find the right people to help. Sometimes you don't have a choice. General practitioners are better at finding these things than people would think.
Okay, I'm going to circle back to something you had mentioned with agility. You had mentioned something like heavier dogs. So I have been told by some Malamute breeders that they just don't want to do agility because Malamutes are more of a front, they're heavier on the front end than some other breeds. So they feel that impact with the constant jumping is potentially very dangerous. But a lot of people do agility. What kind of injuries would you see on a bigger breed like the Malamute?
Well, I would expect to see, so that it's not only it's just a heavier dog, period. They weigh more than a Yorkie, right?
Yep.
In case people hadn't noticed. So right off the bat, that's going to put more weight on the front end. They're designed to be a long distance trotting dog, right? Because they were designed to be kind of a cargo dog, not a fast sprint racing dog. So the other problem too is also their structure, and that the angulation of the shoulder. So if this is the shoulder blade and then this is the humerus, the angulation on a lot of dogs is maybe around here, but in a lot of these northern breeds, they're going to be a little bit, especially the bigger dogs, are going to be a little bit more open like this. So that means there's less absorption of the load of landing from the spring because there's not as much of a spring. The spring is more like this and it may do this versus like a greyhound where the spring might be more like this. So that is going to add more load to the soft tissue in the front, like the pectoral muscles here and the biceps muscle, is going to be right here. Those can actually put a little bit more load on that. That's going to put load at the base of the neck because if the lower joints aren't able to take the impact of landing, that's going to disperse up, and then there's going to be more load and more force that gets dumped into the shoulders and gets dumped into the base of the neck. So that would tend to be probably one of the issues that I would expect to see with any dog, any large breed dog, not just Malamutes, any large breed dog that has a very straight angulation and is a heavier dog, because there's more of they may pull themselves a little bit more going up the A-frame. There's a little more braking they have to do when they come down the backside of the A-frame, both and on the dog walk. On the teeter, they may have to brake a little bit more. And it's also because they don't tend to change the distances between the weave poles. It's a little bit harder for a larger breed dog. I mean, the front end is now starting to make an opposite bend while the rear end is still bending around the pole behind it. So there's a little bit more stress in the back and because of that. So they'll tend to pull themselves through the weave poles rather than pushing them and bending through the weave poles like border collies will.
Did you just make a case for petitioning AKC to widen the weave poles for bigger dogs?
I will let you guys make that case. I think it would not be a bad idea if you're starting to get to the levels where the dogs are a little taller in the shoulder.
For agility, like I'm assuming, would those injuries show up more obviously, or would they still potentially be subtle in the early stages?
Any injury, well, it depends. Any injury can be either subtle or it can be a very overt. The problem is sometimes the injury itself is the end process of several little stressors that there was probably a little bit of warning for that, but you couldn't find anything sore and you couldn't really figure it out. And it may not be, so then you have the final step, the final trigger that then makes the injury show up, whereas that actually wasn't the thing that actually started the whole process. So when you get an injury, you get it because of one of two things. You either have an abnormal force on normal tissue, or you have a normal force on abnormal tissue. And so that latter one especially is where you have a normal force on abnormal tissue, means you've had a lot of little tiny injuries, a lot of little stressors that the dog maybe took one funny step and then it's fine because, you know, they tune things out because they're tough dogs. And then you go out and you do something that's a normal thing, like step off of a curb. And then the dog all of a sudden goes, ow, I'm limping. And you're like, what? Where did that come from? So you tend to think that it was that stepping off the curb that did it, when actually it was a progressive issue that had been coming along because of all the jumping or in and out of the car or sledding on punchy snow or, you know, turning on slick grass or something like that.
Okay, that's actually really important because circling back to these Arctic breeds are tough and they won't show you. I
Right.
mean, how long did Abby run on a torn muscle until not doing something else showed the torn, like revealed it? So,
Right. Right.
yeah, that I think that's important for people to know.
The other thing to understand is injuries can be stacked, is what I call it. So you can have a lot of multiple little things that happen. This tissue got a little strain here, this muscle got a little strain there. And then eventually what happened is you got another injury somewhere else that came about because the two other tissues weren't able to do their job. And then you get an injury in another tissue that's either downstream or upstream, so to speak, mechanically. And then that's the one that finally shows that there's a lameness. That's what happened with your dog. And also you can see, I call it unzipping. You can get a little injury, a little tweak in a tendon or a ligament, or some fascia or something. You get a little injury, and then on the bit, so the big incident, like falling off of the A-frame or something, causes a little injury, and it's in there, but it never really heals. And then they go out and they do normal life stuff, and it just kind of continues to unzip until finally it's unzipped to the point where the dog goes, yeah, so this isn't working very well for me. And then you bring them in to have them looked at. And so it's important with injuries for veterinarians and owners to understand that moment in time when you all of a sudden you go, my dog is lame, is maybe just the end point of a whole process that's been going on over a period of time. And so you have to go back and try to look at all the other little history things of, well, maybe 3 months ago they weren't doing this quite right, and then a couple months ago they just stopped doing that. And you have to put them all together to develop the pattern that created that particular injury on that particular moment.
Okay, so this is kind of like a little divergence maybe, but sort of related. So you mentioned to me, and if I can't mention this, I'll edit it out, but you had mentioned you worked on Jesse's dogs before the race, but they needed very little done because of his dog care. So are there things we can do on a regular basis with our active dogs to kind of treat these little things without even knowing they're there, but kind of take care of them before they become big things?
Well, yeah, sure. So overall management, long term is important. I mean, that's what athletes get. You spend 80% of your time training, 20% of your time competing. So it's not the competition is where the injuries usually happen. It's usually in training. So what you can do is you can straight structure is one of the most important things. So I'm biased, but I think that doing regular chiropractic or osteopathy, regular body work is really important. doing a lot of stretches, and passive stretches you only do after exercise. You do active stretches by taking a treat and asking them to maybe, bend around and, get a cookie or something. You only do active stretching before exercise or a run or whatever, and you do passive stretching afterwards. And making sure they're getting a good diet that is full of the nutrients that they need to keep their tissue strong and recovering quickly. And in dogs, we know the thinking in physiology is starting to shift in dogs. We used to think that dogs were all about protein and all about fats. But with the Iditarod dogs, they're actually even discovering that those dogs actually need more carbohydrates than what we originally thought. And we're finding out that dogs have more glucose transporters, 4 times the number of glucose transporters than horses and humans. So,
Wow.
so the thinking is now shifting on what we think we need to do to give dogs to help them recover and help them prepare for exercise. And we're now finding that doing post-glycogen loading, where you give them a small sugar meal, like within 20 to 30 minutes after they're done racing, actually improves their recovery. And then they're less likely to start breaking down proteins to make their carbohydrates that they need to power the cell. They don't tend to break down the proteins as much, and so they'll kind of leave their muscles alone and tapped into, so to speak, as an energy source.
Right. Okay. So let's say someone has a 4 day show weekend where they're doing agility. Let's say they're doing 3 runs a day, so that's a total of 12. Would you recommend that kind of thing for something like that?
Yes. So a dog like that, I'd probably recommend anyway that they have a diet about a 20% carbohydrates. And I'm talking good quality carbohydrates, not cheap, crappy grains that are often the common ones in kibble. And then I would recommend that you do quick little small sugar meals after every run. I mean, if you have 2 runs almost back to back, you don't really have time to do that. But it's important to look at electrolytes as well too. So what I usually recommend to my clients is that they either do after they run, if they only have like after their last run of the day, especially, they use like a yogurt, honey, berry mix because they get the calcium and magnesium from the yogurt, and then they get the sugars from the honey or the berries. If you're doing a lot of, if it's a hot day, then I usually recommend that they use an electrolyte instead. And we will use human electrolytes because I'm not very impressed with the few canine electrolytes that are out there. You can use human electrolytes or you can use coconut water as long as they haven't added anything. Obviously, no stevia. No, stevia is actually short term is okay, but certainly no xylitol. But I tend to try to avoid, if you're going to sweeten something, just make sure it's good old fashioned sugar and nothing kind of fancy, and not that much, just a bit. But like I've seen several of the sprint mushers when they come in after their 30 to 60 mile run, depending on what the leg is I saw one guy, what he did is he had his handler had a cooler that was full of bone broth and a French, it was a Quebecois musher. And so they had a Canadian electrolyte, and he mixed the electrolyte in with the bone broth. And then he would just go and he'd throw the pans down for the dogs when they would come in. And then he would just go by and the first thing those dogs would get is they would ladle in the electrolyte, and then they would ladle in water after they drank the electrolyte. And he must have been doing well because his dogs routinely actually do well in competition. So I usually have like my search and rescue people, they'll carry honey packs in their pockets. And when they start to see that the dog is flagging a little bit, has gotten overheated, they'll give maybe a little honey water, or they'll give the water or electrolyte separately, and then maybe give a little bit of honey. In the US, the electrolyte I like to use is an organic one called Scratch. It's spelled SKRATCH. And you get it as a powder packet. And what you do is you just mix up the powder packet in the water and then dilute that in half again so you don't get any diarrhea. And then that's what we offer the dogs. One time at an agility trial, we had a bunch of dogs that were crashing because of dehydration and electrolytes. And I wasn't supposed to be the treatment vet, but I became the treatment vet. And what I had them do is just run to the store and get some Gatorade. And we diluted the Gatorade in half, and then we offered them both regular water and we offered them a bucket or a bowl of Gatorade. And we let them choose free choice, which they wanted, the water or the Gatorade. And just as a small thing, the dogs seem to prefer lemon lime over fruit punch or, I don't know, mountain cool or whatever it is.
Yeah.
So
We'll put that in the show notes. Lemon lime.
lemon lime.
Yeah. So how can we avoid that dehydration and crash? I mean, most of us are in the lower 48. Well, this is worldwide, so but I think the whole globe is pretty warm these days for most of
Yeah.
us. So,
Mhm.
um, like let's say we're just out on a recreational run. We have a small team, 3, 4 dogs. We're only maybe doing 10, 15 miles, but it's a warm day. Like what kind of I feel like a lot of times people would say, "Oh, you don't need to hydrate, just water them after." But what do you Malamutes aren't fast. They're not doing that in an hour.
Well, I mean, it depends on what you mean by like hydrate versus offering water. And also for agility people, I mean, anybody who's doing anything with the dog where there's more sustained activity, we know now from some research that say with the sprint and mid-distance sled dog and distance sled dogs, we know their body temperatures can get up to 105 to 107 sustained. And that's one of the reasons why in those dogs, they actually think that ulcers what happens is that they just kind of cook the lining of the stomach, and that's what causes ulcers. Dogs, the good Lord gave us the most amazing athlete out there, and then he attached the worst cooling system to it because the only way that dogs can cool is through their mouth, and it's evaporating. It's that evaporation of the fluid in the mouth that allows the blood exchange as it goes up into the tongue and up into the mouth to actually cool off, and then that gets back to keep the core temperature lower and the brain temperature as well too. So so if they have their mouth, I mean, if we're in a dry area, so the problem that'll happen with that is yet, yes, they'll cool down, but then they dry out really fast.
Mm.
So if you're in an area that's a very low humidity, you probably need to stop and offer the dogs several drinks and allow them to get, and then you can do it as regular water or you can do it as an electrolyte, whatever you think the dog is going to need. If you're in a more humid area, you probably don't need to do it quite as much as long as there's a fan, as long as the dog is moving, because that creates a little wind around an evaporation barrier over the mouth. But the minute your dog stops, then the only wind they've got is to move the air by panting around it. So that's why sometimes, taking a book or a paper and or putting them in a fan, putting like a little fan. I have a client that has one of those little hats that has a fan in it.
Hmm.
And she'll actually stand over the dog and let it and fan the mouth with that when she's doing agility if the dog needs it. So you have to look at your relative humidity. You need to look at your air temperature, and you need to decide, is this an appropriate day to take the dogs out? And then do what is my responsibility to be able to keep them cooler. I saw a paper recently that came from Dr. Cindy Otto at University of Pennsylvania, and they did a study with poacher dogs over in Kenya. And they actually found that dogs that are super high drive and you have a squeaky toy for them, you can drop it into a bucket of water. And the dog, if you can get the dog to learn how to dunk its head, then that they found that to be very effective for cooling the dogs off in general because it keeps the brain temperature down and it also wets the mouth again. So,
Hmm.
yep. So just be aware. And once again, it's an awareness, it's an observation. Oh, my dog is overheating. The more the tongue is coming out, the more it turns into that kind of cupped flare at the bottom. The wider the mouth is, the more that dog is really hot, is recognizing it's hot, and is trying to expose as much surface area as possible to cool.
Okay. What about if, because I think a lot of Malamute people might support this. I don't know. I'll probably get a lot of emails saying I'm wrong. But I have found that unless they've already overheated, they won't take just plain water. They're just not interested. There's been, I know over the years, there's been talk from some old timer mushers that they don't believe in force watering the dogs by baiting it.
Right.
But I have found I've kind of had to bait water for the dogs in order to hydrate them when I want them to drink.
I think it depends on your dog, and that's why, a lot of mushers will breed. We're back into mushing now, but it's any active dog. It's knowing your dog and knowing whether your dog will want to drink. Now, if the dog is desperate enough that it's trying to cool, then it's more interested in having the air movement in the mouth than it is than closing its mouth and swallowing water,
Mm,
taking the time for that. So a spray bottle, and in a desperate situation, you can also use a spray bottle and spray water onto that tongue and a fan, right? Anything you can do to cool them off. But a lot of dogs will dip when you're mushing. A lot of dogs will dip, and you should watch people who mush their dogs should pay attention to make sure they're not seeing any sores on the nose, and what the snow crystal type is, because And also if they see the dogs dipping more. So if the dogs are dipping more, it may be either because they're hotter. So is their sun out? Do they not have a reflective coat on? Or is the snow so hard and crusty that they can't get the moisture that they need in order to help, keep things wet in their mouths? So,
Okay,
and then
interesting.
with agility, anybody who's doing something around a camper van or can be inside, that's a little bit different, but you still have to recognize when your dog is overheating and take the appropriate steps. And those things can sneak up on you if you're not paying attention. If you're going, oh, I'm working out of I'm at an event that's, outside of this really nice facility, and I can always go into the facility if I need to. That still doesn't mean your dog can't get overheated. So you just have to watch it, and then it's easier to stop the overheating before it becomes really serious than it is to finally have to deal with a crisis.
Right. Circling back a little to like injuries, could dehydration lead to injuries?
Sure, because you need to have fluid, flexible tissue that has fluid in the cells, fluid in the fascia around the muscle, fluid in the tendon sheath that helps to protect the tendon. So if that starts to dehydrate, the body's going to start, if the body's desperate, it's going to start pulling fluid out of different places. And if the dog is still moving and running, it could actually lead to torn muscles, torn tendons. The animal's more fatigued. So it's not as exact in the placement of its footfall and being able to hold its body core together. And so it's more likely to kind of take funny steps and maybe slip or slide and not be able to hold itself up. So yeah, absolutely.
I don't know. Let's see. So we've talked a little bit about sledding, agility, um, backpacking. Okay, dogs that carry a load on their shoulders. Is there anything unique to that, given that they could be carrying up to
So
30 pounds on
yeah,
their front end?
the trick is how do you know how balanced your backpack is? And what if the dog has a little bit more weight on one side than the other? The other problem too, I have a picture that I use in my lectures of a friend who was backpacking with her Alaskan Husky, and all of the stuff was stored high in the backpack. So it actually shifted the dog's center of gravity
Oh,
instead of having it down low around the side. So if you have it around the side, that would be fine. But just be careful not to have things too high, because then the dog, whoa, can't keep its center of balance, because you have now, and dogs need to be conditioned to be backpacking as well. So they need to be conditioned to carry that kind of weight up and down hills and strengthen the appropriate muscles just as much as they would if they were going from agility to sledding or doing herding or something. So you can't just say, if you want to guarantee a visit to a veterinarian, it's to take your weekend warrior, say it's your agility dog that you periodically do some agility stuff with, and then you decide to go on even a 3 to a 4 mile hike with a backpack where it's inappropriately packed. It's a little heavier on one side than the other, or if the center of gravity is too high. And even though your dog is actually fairly fit, it may not be fit for that activity. And then it would be easier to get hurt on that just 3 to 4 mile hike.
yeah. I typically come off the sledding season right into backpacking, but I do warm them up a little bit to carrying a load just because it's different muscles.
Yeah, and so remember with your sled dogs, right? So if we have your dog torso is like this, with a sled dog, when you have the harness on, the tug and the force and the pull from the tug line to the gang line is set rather low versus a backpack that's going to be setting up a little bit higher. So you just need to be aware of that when you're getting them transitioning from sledding season into summer hiking season.
Have you seen any differences between like snow sledding and dry land?
We don't have a lot of dry land here. I don't have a lot of dry land dogs that I work on. When I've talked to my European friends where they have a lot more dry land, they will tend to see a little bit more foot issues because, the snow can be very cushiony. And where we worry about snow is where it's dropping off, like it's becoming uneven and they'll punch through a foot in one area, or they slide off a frozen ridge on another, or they're more on ice. But with dry land racing, I mean, it depends on how hard packed it is, the rocks and where you're training or where you're running your dogs, and how consistent the trail is. If the trail is notoriously very hard, then you're going to maybe see a little bit more shoulder issues than you would normally see when you're sledding on snow.
So transitioning from snow to dry land, would you back off the miles and allow an adjustment?
Yeah, I would. I would probably back off the miles. Certainly don't run them with any backpacks on originally, right? Because now you have to switch them to a little bit of a different terrain and it's a little bit harder. So you maybe want to take maybe 4 weeks or so, 3 to 4 weeks, in running them on a shorter distance, but obviously different terrain.
Mm-hmm.
And then after that, you know your own dogs. You know, if they're a young dog, they should adapt a little faster than an older dog. And then you can start maybe moving them up, but watch them as you're moving them to make sure all is good.
Okay, let's talk about some of the fun things people do. We talked about barn hunt, like farm dog is a new one that a lot of people are doing. Trick dog. What else do we have? A little bit of tracking. Scent work has become really popular in the
Right.
United States.
And then you've got rally as well too.
Mm-hmm. Yep.
Right? I mean, those are all going to have, it's just looking at what the dog is doing and just figuring out what's the repetitive stress. Like, what are they doing all the time that could be a repetitive stress? And then training for it. One of the most important things you could do to make your dog very resilient and to make your dog very flexible in changing jobs would be to make sure you have good core strength. And there are a lot of videos, a lot of books out, even workshops and stuff. The agility people are really good about that stuff. And so there are a lot of, I'm sure there's a lot of resources that Malamute owners and dog owners can find to be able to keep their dog's core strong. If we want to, I've got a nice little handout that I put together for the avalanche dog handlers on how to get your dog's core strength up, and I can get you a copy of that and you can attach it to the bottom of this if you want to use
awesome.
it.
That would be great. Okay, so we've covered all the sports and the possible injuries. You mentioned, like do active stretching before and then passive stretching after. So like people can learn to stretch their dogs. I mean, they can find a massage therapist or learn to massage. When they're doing that, I know I hear a lot of mushers say they're always looking for areas of unusual heat. Like, is that
if your fingers are sensitive enough?
right? So, I mean, I guess dog owners could learn massage themselves as a
Yeah,
like
I think not only massage, but also palpation, because not even veterinarians anymore are good at palpation. I know I'd probably lost the skill. I was never really taught the skill till I took the chiropractic training. And remember that you're using these and they need to be taken care of as well. And the harder you push down on the tip of your finger when you're feeling something, the more you shut off the nerve supply to the tips of the fingers. So when you're palpating, it's always best to have a light touch. A friend of mine says, come in and land like a butterfly. So, and then you just kind of feel from there. You need to teach yourself how to feel differences in texture and then how to put together a picture in your head of how the relationships are all put together on what you're feeling. So I always tell clients, if you're a vegan, you may have a hard time with this, but I always tell my clients that if you feel what feels like a like raw steak, that's a healthy muscle. And the more it starts to feel like a cooked steak, that's a muscle having spasm. And if you actually feel gristle, like if you were feeling like a T-bone or something that had some gristle in it, then that would actually be actual scar tissue that you're actually probably feeling in the muscle of the dog. So probably even more than feeling heat, because that one's a little tougher. And unless you have your own thermal imaging camera to show you where the hot spot is, and you can go touch it and then touch another spot to say, oh, I can feel the difference in that. Probably just palpating texture is much more important.
What about cool down after activities?
I mean, it's a little, everybody has a different thing on how they do that. And, it's just like anything else, let them kind of wind down a little bit. We don't have to worry about cooling off superficial muscles because they're not sweating the surface like humans are and horses. But I mean, the biggest importance is to make sure as long as they're cooling because their heart is still going. And the heartbeat and the amount of fluid that they're moving through that heart is how they cool themselves. So you want to just maybe do some light walking. If it's hot, wet them down. Even though they don't have sweat glands on the skin, wet them down anyway. It's still going to help out. And so you want to just do some walking around, stop doing jumping and, running and zooming and doing stuff like that. Hopefully they're too tired to do that. But you still want to maybe walk them around a little bit, stand in a fan, give them some water, walk a little bit, do some stretch. I wouldn't do a lot of passive stretching until after they've actually, their heart rate is down and they're actually kind of a little more sedentary. And then you can, take the leg and just kind of stretch it out a little bit and do some, twisting and rolling to see how it's doing for passive stretching. But I mean, everybody's going to do their own cool downs. And it's not a good idea to take them either right off the line, right off the right off the show. You run your run, and then you just gotta go home, gotta make dinner, and then just throw the dog into the car. That is asking for muscles to seize up and spasm. So it's still good to walk the dog around the car a couple times, go for a little walk over to the judge's tent, go see what your score is, and then walk back and then put them in the car.
Okay, so not straight to the crate.
Nope, not straight to the crate.
Okay.
After a drink, so drink and then cool down.
When is massage best utilized?
Not well, probably in between runs, or if it depends on whether we're doing maintenance massage or whether you're dealing with an injury.
Okay.
So it's kind of hard to say. I mean, I have people that'll get their dogs massaged. Some of my really hardcore agility competitors will get their dogs massaged once a month. Or if they're at a competition and there's a massage therapist there, they'll do it a day or two before they're going to run, or they do it as soon as, like after some cool down, they'll do it as soon as they're running, their runs are done and before they're packing up to go home.
I typically have done it pre-season and towards the end of the season, largely just because it's hard to get to the massage therapist.
Right. Well, there's that too. Timing is an issue as well.
Yeah. Okay. I don't know. I think that's got a lot of great information for everybody.
Also, might be too much, but watch it a couple times. We didn't get into specifics of how to address different injuries, but that's a little bit trickier. I guess the last thing I would say is just make sure when you go to your veterinarian, if you think there's something wrong with your dog, stay true and strong to your message and make your vet feel things. I got some of my experience was when my client said to me, I think you missed something. I know there's something wrong with my dog. And these are people that I know are good observers. Someone like you that I know is a really good observer. And that means you're not just making it up. And that means that the problem isn't you or the dog. The problem is with me. And so I went back through and looked again. But I had that mantra from my freshman year of vet school, for everything you miss because you don't know, you miss 10 because you don't look. And that's how I found things, or I would research something, go, oh, look, here's a test I didn't know about. Maybe let's try that. Oh, look, guess what? Your dog's positive for that. And then make sure if your veterinarian has imaging, take advantage of it. If there's anybody in the area who does thermal imaging, I've got a bias here because I've been doing thermal imaging for a long time. And thermal imaging is amazing for finding soft tissue injuries and for the mild, small soft tissue injuries. And you just have to make sure you find someone who knows what they're doing, has an appropriate camera. Some of these cameras that go on your smartphone are fun, but they are not the high enough resolution to be able to really detect a problem. Not yet. They're getting there, but they're not yet there. Because I've tried one. I took a little Seek camera with me to Norway to try on the sled dogs at the Finnmark. And we found a couple of things, but it still wasn't quite as fine-tuned as my nice big FLIR camera is. So, but the best diagnostic tool we have are these, if we use them. And so if you find something, say something to your vet and really push it until it gets resolved. And don't go back and run on it just because, oh, my vet said it was fine and my dog looks like it's okay, because it might not be. It might be, but it might not be. So always...
I feel like you're talking about someone that you know.
No, I wasn't. I'm not picking on you. We got that diagnosed.
Yeah.
But we got that diagnosed with thermal imaging. And if there's somebody in the area who knows, we also did musculoskeletal ultrasonography, an ultrasound. And that's a growing field of doing, but I come from the horse world where we'd ultrasound anything anyway. And so now the small animal people are starting to figure it out. So I really encourage dog owners to find someone who maybe has a thermal imaging or does a really good, thorough musculoskeletal exam with these. And then if there's a doubt, if they have an ultrasound, have them pull out the ultrasound and ultrasound it. A lot of the techniques for ultrasound are not published. We don't have a guide on how to do canine musculoskeletal ultrasound yet. So what I do is I ultrasound both sides. And I look at the hopefully normal side, the one that's not having symptoms, I'll look at that one first, and that gives me an idea of what the normal anatomy is, and then I'll go over and I'll look at the side that has the problems, and hopefully we can find a difference that will say, oh, there's your problem right there.
Yeah, and we'll have pictures of that in the article coming up in the next issue. The normal foot and the injured foot.
Right.
Yeah. So that'll be
Okay.
great for everyone to see. So thermal imaging cameras, ultrasound for soft tissue, X-ray to rule out anything skeletal.
And do all of those things before you jump to an MRI or a CAT scan. Because unfortunately, I'm seeing some clinics that are, I hate to say this, but corporate, and they're kind of just jumping to the MRI right off the bat because, I mean, I'd like to think it's not because they want to make the money for it. It might be a little bit of an easy way to do things, but, make sure that there's, it's like a pyramid. And you want to have, to me, the MRI and the CT is up here, and you should be doing all these other layers of physical exam first before you just jump to the MRI. Because the MRI, every imaging will have its strengths and weaknesses. So you might as well pool it all together. So, because you might say, oh, look, what is that right there? I missed the MRI, missed that, but I can see it in the X-ray. Or the X-ray was clean, but look, the CAT scan showed this. So just make sure you don't just have somebody that wants to jump to the $8,000 MRI first and work your way up, because a lot of times you'll get the information you need at the lower levels of imaging and you never have to get to that level. If the lower levels of imaging are clean and it's obvious that the problem is still there, then you can go ahead and do the MRI. But for me, an MRI is the top of the pyramid, and you don't do it until you've ruled out all the other stuff first.
Okay. To wrap up the episode, we just have one last thing. Before I tell you about it, I'm going to warn you that in the dog show world, there's a running joke about my luck, and it apparently wants to co-host the pod. I was so excited to talk with Dr. Kim that I completely forgot the closer. She was kind enough to fit in a phone call while she was traveling, and I had all the recording devices set up, ready to go. Unfortunately, none of them worked except for the one backup device that does not have the best sound. And of course, I didn't know any of that had happened until after. But despite the expert sound engineering, this segment is worth the listen. Okay, this segment is going to be called Woo or False. Every episode, I'm going to ask a guest a question about a myth or idea that's within their field of expertise, and they will answer whether it's woo or false. Now, I know some of you just rolled your eyes, but if you're being honest, deep down, you chuckled a little bit. All right, here we are. Woo or false? The question I have for you today is, people who participate in conformation typically like a super short nail, but I've heard others, sometimes in the working community, say that they like a longer nail because it's necessary for traction while working. Woo or false?
Having a longer nail is better for the dog is false. You want to have a shorter nail so that I always try to have dogs pass the credit card test, that if they're standing on a hard surface, just relax, standing naturally, can I pass the credit card between the nail and the floor? And that's because it will keep the suspensory ligament and the flexor tendons in the nail in a neutral position and without any stress on them until they actually land on the foot and the toe flattens out, and that will bring the nail into contact with the ground. Otherwise, it'll make it even worse if the nail is already in contact with the ground when they're standing neutral. Does that make sense?
It does, yes. So false, not woo.
It's not woo.
Okay.
The confirmation people are correct. You want to have a shorter nail, but you also want to try, if you're going to do performance, you want to try to keep the dew claw on.
Okay, so
dogs that are making sharp turns will actually, the dew claw will come into the ground and help to stabilize the foot rather than relying on the shoulder to have to do all the work. It's been shown that dogs without dew claws actually may suffer more shoulder problems than dogs with dew claws doing the same sport.
that is fascinating. So in the mushing community, they often like to remove the dew claws it makes it easier to put booties on. But I've also heard people say they get less tears in the dew claw. I have never had that experience myself with torn dew claws. Is it both, or is it just easier for booties?
It's for booties, because the booties aren't made to go up over the wrist, and so they tend to stop at the area where the dew claw is. And with all the repetitive footfalls that those dogs do, it can actually cause some wearing of the booty against the skin of the dew claw, because there's a bump there. But those dogs also are not making sudden, short, fast, sharp turns.
Okay, that's fascinating.
So
I learned a lot more than I thought I would with that simple question.
Yeah. Well, that's the point, isn't it?
Yeah. That wraps up our first episode. My tremendous thanks to Dr. Kim. We will definitely have her back soon. And my tremendous thanks to all of you who stopped by to listen. Admittedly, the sled hit a few bumps, and it's probably going to hit a few more because that's just the nature of it. But nobody wins the Iditarod their first time out. And we do have that saying in Malamutes that what matters is that we get there. So stay tuned on the Facebook page and the website for news about the next episode. If you have a woo or false question you'd like to ask a guest, we'll give you the opportunity to submit that. Also, if you haven't checked out the first issue of the magazine, go ahead and have a look. The next issue releases in June, and we have a lot of exciting articles, including one covering the tools Dr. Kim uses to diagnose injuries. So, until next time.